For the next session, I'd like to call Professor Muhammad Akbar Chaudhry. He is currently Dean of Medical Sciences at Azra Nahid Medical College, Lahore, and he'll be talking about the time for national cardiovascular prevention policy impacting future cardiovascular burden. So, sir, over to you.
Hello.
Bismillahirrahmanirrahim. Respected Chairman, Co-Chairman, dear colleagues, students, I'm very grateful for the management to invite me for this talk. I will try that I convey my message in the allocated 10 minutes. Professor Rauf Niazi showed the light. And when I received this program, it was showing the lightning session. So I was just thinking, came to my mind the lightning which we see in the sky before the rain. Then I looked at the Google and it said, it also means ignite. It also means short lecture. So I think my talk today will be more like ignite, like इसको जिसको कहते हैं तीली लगाना. So I will like to do that so that we understand what is the problem. It doesn't work. So slide changes. That's. Well, I bring you very warm welcome, very warm greeting from Lahore. My topic is the time for the national cardiovascular prevention policy impacting the future cardiovascular burden. Now, last year, Lancet published an article that Pakistan faces double burden of communicable and non-communicable diseases with persistent inequities. That is, गैर मसावात, जहाँ पे जो access to the healthcare facilities is not equal. When I reviewed this, that 20 years back, WHO said that the cardiovascular diseases, 17.1 billion people died of cardiovascular disease in 2004, 29% of all the global deaths. So cardiovascular disease were very common, and their forecast was that by 2030, 23.6 billion people will die from cardiovascular disease, mainly from the heart disease and the stroke. The largest percentage will occur in the East Mediterranean region, where we are, and the largest increase in the number of deaths will occur in the Southeast Asia, where we are. So a survey in Pakistan 2003 showed that we have got a very high prevalence cardiovascular risk factors. So I would like to remember these figures. 20 years back, we had a hypertension that's 18%, 21% in the urban areas, and it was less in the rural areas. Diabetes, so something happened here. Diabetes was reported at that time that 6.9 billion people were affected by the diabetes. इसको आसान लफ्ज़ों में कह के 69 lakhs people were diabetic in 2003. And IDF said that by 2025, there will be 11.5 million. In easy terms to understand for people like me is that 1 crore 15 lakh log honge in the 2025. So 2025 has yet not reached. Similarly, there were high TG levels, there were low HDL levels which are protective, and then obesity was, as Professor Rauf Diazi was talking about, so it was reported 46 to 66%. Similarly, metabolic syndrome. Smoking was 17% at that time, and it was 33% in men and 4.7% in women. So it was profession came up and saying that the coronary artery disease is becoming epidemic and we should do something about it. So what happened? There was a national action plan for prevention and control of the non-communicable diseases. And that was joint publication by the Ministry of Health, Government of Pakistan, WHO, Pakistan office, and the heart file of Dr. Sania Nishtar. But that did not work. That action plan did not work. So Lancet said that it had a national action plan of NCDs, but due to the lack of proper implementation, it has not shown any significant impact. And the disease burden has increased tremendously. That's last year. Our fragile health and economic systems are ill-equipped to handle the current and the future NCD's burden. Although top priority in Pakistan is universal health coverage, its health access and quality of index score has ranked 154th out of 195 countries. Looking at the United Nations Sustainable Development Goals, 188 countries, so we are ranked 164. Even Human Capital Index, which scores life expectancy in education and health, Pakistan is ranked 116th among the 195 countries. So this is an eye-opener. This is the in 2019, Institute of Health Metrics and Evaluation, University of Washington, School of Medicine, with Aga Khan Medical University and the Ministry of National Health Services, they published a paper that Pakistan continues to face a large burden of infectious diseases that is impacting the population equality and inequality, indicating tuberculosis, hepatitis, typhoid, and paratyphoid. So we still have got a lot of communicable diseases. Over the last 30 years, NCDs has increased. Cardiovascular diseases, cancers, diabetes, mellitus are becoming the major cause of death and disability. WHO recently published that we have got a 38% communicable diseases and 50% are NCDs. Researchers forecast that NCDs will be leading cause of death in the next 30 years. Current status of cardiovascular disease in Pakistan is that 50% of the deaths from the cardiovascular disease occur due to the coronary heart disease. This can be reduced by preventive health care. Common modifiable risk factors are dyslipidemia, diabetes, hypertension, tobacco, smoking, and obesity. A paper published recently by the Journal of Pharmaceutical Research showed that a patient who had a coronary heart disease admitted to the hospitals, 52% had a physical inactivity. Nowadays, we know that there are a lot of research papers coming that the physical inactivity is as bad as smoking. Hypertension is 52%. Remember, 20 years back it was 18%, but these are the select patients actually. 48% poor dietary habits. Our dietary habits has gone worse. And in the younger generation, I'm afraid they're going to be very bad because they hate vegetables. Similarly, fatty food consumption, obesity, 38% last year, which was in the patients who had a cardiovascular disease. Smoking has increased 37%, diabetes 30%, and family history of coronary artery disease in these patients was 20%. Another study in 22 from Karachi, people were 68% were obese. मेरे ख्याल में as a senior citizen allowance मुझे कुछ मिल जाएगा. Hypertension 37%, tobacco 48%, fatty food consumption, alcohol. WHO recently published that hypertension is 37% in Pakistan and diabetes 14.6%. But the IDF said in 22 that diabetes in Pakistan is at 26.7%. ये नेशनल डायबिटीज सर्वे जो पाकिस्तान में हुआ, बकाई इंस्टीट्यूट ऑफ डायबिटीज प्रोफेसर बासित, ओवरऑल प्रेवलेंस ऑफ डायबिटीज 26.3%, 19% were non-diabetics, 7.91% were new diabetics, overall 26.3%, and pre-diabetics 14.4%. And as we know that the pre-diabetics have got the same risk as the diabetics, so if we add up, it means that we have got a 40% people who are diabetes or who are pre-diabetics. And remember that first figure was that we were if we calculate on these, if we calculate only 26% diabetics, so 25 करोड़ में से 6.25 करोड़ diabetics हैं. और अगर आप ये भी काउंट कर लें तो इट विल बी 10 करोड़, 25 करोड़ में से 10 करोड़ लोग हैं डायबिटिक्स. तो ये आई ओपनर है हमारे लिए. सिमिलरली एडल्ट पॉपुलेशन में हमारे ओबेसिटी 25% in the survey. It's close to what Professor Rauf Niazi said, 22%. So it is in men it's 22%, in women 33% in the urban areas, but it is less in the rural areas. What is the solution? So ये हम recommend करते रहे हैं कई सालों से. Stop smoking, physical activity, diet therapy, weight control, blood pressure control, lipid control, diabetes control, and in very high risk patients, aspirin. So it has not worked. What is the impact of cardiovascular disease in Pakistan? So NCD's total deaths, 5.8 billion. 81% of the deaths are due to the NCDs, non-communicable diseases. 226 billion have got a disability. These are deaths and these are the deaths, disability. And according to the WHO 2020, 240,000 people died of coronary heart disease. It has not only a health burden, but it also has an economic burden. Every 10% increase in the NCD's mortality reduces your annual growth by 0.5%. So, lifestyle modification again, guidelines were suggested. So, diet, we have to change our diet patterns, fast foods, etc. We have to educate our younger generation. मैं देख रहा हूँ कि जितनी जितनी मिठाई की दुकानें खुल रही हैं, उतनी ही फार्मेसीज उसके साथ साथ खुल रही हैं. Treat, control major risk factors, cholesterol, hypertension, diabetes, adiposity, stop smoking, and use of tobacco and other forms. So I'm worried about when I see my university and college students having smoking so much. So it has increased tremendously. Encourage physical activity, as I said, that is as bad, sitting in the office is as bad as smoking. Air pollution. So you may have read some paper recently that the people who are breathing in the urban areas, in the mega cities, they are inhaling equivalent to 10 to 15 cigarettes a day. So that's our air pollution. Prevent chronic kidney disease, and that could be prevented only by control of diabetes and hypertension, because these are the two major which they cause chronic kidney disease. And of course, in the very high-risk patients, 75 to 100 milligrams of aspirin may be useful. Now, what is the way forward? New National Action Plan. So I will suggest through the offices of this organization, through the PSIM, that the medical profession and researchers should sit together and review the National Action Plan of 2004 and suggest amendments as needed. Policymakers, health ministry, government should be apprised of the situation of epidemic of cardiovascular disease and its impact on the economic burden. Recommendations of the new action plan with the suggested intervention should be submitted to the government to incorporate in the national health policy and legislation. Pakistan is in the critical need. More suitable investment is required in the health system, policy intervention to save and improve the people's health. Government should provide suitable budgetary allocations, policy for the policy implementations in the true spirit to control this problem.